Cassi from NABC's Vetfolio and the host of Vet2Vet. Intestinal parasites and concerns about resistant parasites are something that we are very familiar with in the Southeast, and specifically here in Florida. And I have so many questions about this topic. Joining us today is Dr. Michelle Evason. Dr. Evason serves as Global Director of Veterinary Clinical Education for Antech. She's worked in veterinary general practice, academia, specialty clinical practice, and the animal health industry. Dr. Evason has published on numerous infectious diseases, antimicrobial stewardship, nutrition, and spectrum of care. We're so happy to have you here with us today, Dr. Evason. Thank you so much for joining me.
Hi, everyone, and thanks so much for having me, Cassie. It's a pleasure.
Absolutely. I'm so excited for this conversation because it's on something that honestly I feel a little unclear on, and that is Giardia. Kind of when to treat, how to monitor. You're laughing, which makes me feel like I'm not the only one with this question.
No, you are definitely not alone.
That makes me feel much better. But yeah, can you walk us through on, how do we identify this and what do we do when we do identify it? And how do we follow up with these patients?
Two things. One, please, it's Michelle. And second, I'm going to repeat loud and clear, you're not alone. And I think all of us struggle with this. And number three, I'm going to fess up that I suspect other experts as well don't have all the answers when it comes to Giardia. So all of us are sort of trying to wade through this. A few things that I think we, collective we, do agree on is that in order to make decisions about Giardia, we need to be thinking of what is that patient coming in for, right? Is this a pet that's coming in for, we'll use a dog as an example, for the recommendations as per the Companion Animal Parasite Council guidelines, the Cassi group guidelines for that, for an adult dog, a annual or twice annual fecal test. As such, it doesn't have clinical signs of diarrhea, or is it in fact a pet that's coming in with clinical signs of gastrointestinal disease, typically diarrhea, which is prompting us to take that first step of an infectious disease workup and think about testing to look for GI parasites, Giardia, of course, being one of those. And so once we've kind of got those sort of two buckets or bins, if you will, sorted out, is it a well pet that's coming in for fecal preventive care, or is it a sick pet or a pet with clinical signs that has prompted us to do a gastrointestinal infectious disease workup? Once we've sorted that step one out, we can then move along with respect to decision making.
Okay, that makes sense. So we're going to take a different approach depending on if we have a symptomatic pet or an asymptomatic pet. And that makes sense because I think that's where I've been kind of unclear of, one, how are we diagnosing this? Because I understand it's probably not something we're going to find on, a fecal float with centrifugation that we're typically running. So, if by chance we do find it, then what are we doing and what are our endpoints when we're treating this?
And again, great questions. And I know, and I didn't intend to, but I know that I didn't answer all the first set of questions.
Oh, there was a lot of questions in the first set. So
okay. Well, and we all have questions about Giardia, right? And it's not like there's one or two, there's quite a few. And so for me, it's again, focusing on that first step, one or two. And you're right to make the comment about fecal O&P, if you will, whether that's being done in the clinic setting or whether it's going to the reference lab, because fecal O&P is sometimes not, it's not that it's a bad test. It's not, right? It's a great test. However, when we're talking about tests and what we're trying to find, especially with screening tests, we're sort of thinking about what test for what client. And I think more and more these days, we're leaning towards things like PCR testing to really help us get that additional perspective or fill in some blanks or use the word sensitivity or agreement, if you will, when we're comparing O&P to something like a PCR. And specifically for Giardia, certainly PCR is vastly superior in terms of detecting that. And so back to are we doing screening and have we found Giardia for example, with a PCR on a well pet? And if the answer is yes, then the larger group of experts these days, we do seem to have consensus on that if we're finding Giardia in a pet that is asymptomatic or doesn't have clinical signs, is we're not treating that pet. And the reason for that is the reasons for that are myriad, actually. One, of course, is we don't have a sick animal. And so ridding them of something, what are we trying to achieve with that? Right? Does it just make us feel better? Does it make the owner feel better? Are we even going to be successful at ridding them of that? The other aspect of that, of course, is antimicrobial stewardship. And which drugs are we picking? What duration of that? And again, more and more, the consensus is in animals that don't have clinical signs, cat or dogs, where we're detecting Giardia, then we're not recommending specific treatment with a drug or with anything else because those are well pets. The other group, of course, is the pet with clinical signs that is sick. And if we're detecting Giardia in those patients, then yes, typically if it's a patient that has clinical signs like diarrhea, and we're detecting Giardia, the recommendation, and again, the sort of the simple way to answer this question is to defer to the CAPC guidelines with respect to treatment recommendations, because yes, very much in a pet with clinical signs that we detect Giardia, the recommendation is very clear that we treat that pet.
And I want to go back to what you said about PCR testing, because you're right, we're seeing this more and more. And, thinking specifically with respect to Giardia, I've tended to reach for tests like a Giardia antigen or something, generally in a sick pet, because, like you said, I'm not generally digging for something like that in an asymptomatic pet. But what about just kind of general recommendations around PCR testing on fecal samples? Should we be doing that more often?
Yeah, it's a great question, and I'm not trying to deliberately waffle. I know I'm an internist, so it probably seems like we waffle all the time, and there is certainly some truth to that, which I won't deny. However, I think the most honest answer to which test is also very clinician, pet owner dependent, right? And so the right test for me in a certain setting may not be the right one for another practice in Florida, or one in Alberta, or wherever that might be. So those choices are very much dictated by the individual situation that we find ourselves in. In general, we do know, based on research that's been completed, that PCR as compared to ONP is superior for pathogens like Giardia, as well as whipworms, as well as the more common ones that we are looking for as part of that infectious disease workup in a pet with diarrhea that you asked about. And so if I have to choose, and of course too, when I'm thinking about cost and affordability, because of course on my bio you've probably found out that I'm quite passionate about spectrum of care. Cost is sometimes part of these conversations, and I'm grateful that there is a PCR test available that is affordable, and that also captures not just one parasite like Giardia with an antigen test that's specific for that, but also 20 parasites on one panel, along with markers for hookworm resistance, as well as providing information on if Giardia is detected, whether it's Giardia of zoonotic potential or not, because that's another conversation that we're often having, since it's not just the two legs or four legs, sorry, it's not just the four legs that we're accountable for, it's often the two and their family members that we're getting a lot of these sometimes challenging questions about.
Absolutely. And I'm glad that you brought that up for a couple of reasons, because one, we're going to move on to hookworms here in a minute. And that is a parasite that I have so many questions about, being in the Southeast, and some of these other parasites that you're mentioning. But I love that you brought up zoonosis, because that's kind of part of what I struggle with when it comes to Giardia. Is we know there's a zoonotic potential, but it sounds like you're saying not always a zoonotic potential. And so I guess my question would be around, what do we know about zoonosis? How do we communicate that with owners? And then the endpoints when we're treating Giardia, because I would think we're treating to resolution of clinical signs, but if there's a zoonotic potential, do we need to treat to clear it?
Yeah, and again, another flurry of questions, and hope which are
There's
all
so many
warranted because
questions.
we all have them, right? Like
Yeah.
there are so many questions, and I think for me, one of the reasons I'm quite passionate about the PCR panel is because it does provide that aspect, again, specifically to Giardia, about whether it's zoonotic or not. And prior to that time, when we had a Giardia detected, we sort of had to assume that it had zoonotic potential, right? Now we know with the marker that's included on the GI parasite panel key screen from Antech, we now know whether it does have zoonotic potential or not. And based on research that we've done, we know that in dogs, less than about 4% of the Giardia that we're detecting in dogs based on our research are in fact of zoonotic potential. So that really helps us to reassure pet owners when we get a Giardia detect back. We can say, look, the marker hasn't been detected, which it usually isn't. And so we don't need to be concerned about zoonotic complications or aspects, which are a very real thing. It's kind of a funny thing to think about how things have evolved in veterinary medicine, because of course these days we're accountable for so very many things beyond just that specific pet owner. There's zoonosis, as you mentioned, there's antimicrobial, and these all really swirl around Giardia, which I think is part of it. Specific to your resource question, again, I always defer to the Cassi group. So they have all of this freely available on their website. And then in Canada, the Canadian Parasite Expert Panel also has all this information freely available on their website. And then Antech, we've also created some resources as well to help with all these questions, because we get it. Our consultation service takes over 800 calls from veterinarians daily, often about Giardia. And so they can be a good resource as well to have some of these conversations, because some of them are going to be very unique to that particular pet owner and veterinary scenario.
So you've made me feel much better about having these questions about Giardia, because it sounds like it kind of defaults to the universal answer to medicine of it depends. And so there's a lot of resources available to get more information about maybe a pet with clinical signs, Giardia and zoonotic potential, and how to treat, what the endpoint is. And then, like you said, at the end of the day, if we just can't figure it out, phone a friend and say, hey, what
Exactly.
do I do about this pet?
Yeah, exactly. And I also don't want to appear to I'm going to use the word waffle again, or sidestep any of your questions. I think for the pets that you asked about, the ones that are Giardia detect do have zoonotic potential but don't have clinical signs, what do we do there? And I think for now, no one's really sure, right? I think in those situations, again, I'm going to frame it up again. Hopefully, I got what you said correct. Is we've detected Giardia, we don't have clinical signs, but we've also had the key screen test come back with the marker for Giardia of zoonotic potential. What do we do then? Do we treat? Yes or no? Again, I think we're not sure in those situations. And again, after assessing that particular pet owner, are they into what we sometimes refer to that YOP group? So young, immunocompromised, pregnant, older. In a situation like that, it might be reasonable to treat if, again, that zoonotic potential marker lights up. But again, it's not clear, and the reality is we need much more research to help fill in some of these gaps, and we're getting there. We're certainly trying to add to the literature with the results of the studies that we've done on the key screen GI parasite panel to date, but of course there's lots of questions, and the way it always is with research is the more you do, the more questions that you have.
That means you're doing a good job.
We're certainly trying, and again, I will emphasize what you said. Phone a friend, because we get it, and no, you're definitely not alone. And I think the other thing, and this is the clinician as me, is totally get it, and totally get that having these conversations across the exam room table or on the phone, they can be tricky.
Yeah, they can be, but I think this conversation here has really instilled a lot of confidence for me, because you kind of realize it's not cut and dry. So you have to do the best you can. in each scenario. And I think that is a really empowering message to say, look at the Cassi website, phone a friend, talk to the owner, and treat it as an individual situation. And the way you approach it isn't going to be, I can't believe you did that. Do you not know how to treat Giardia? It turns out no one really knows how to treat Giardia. We're still figuring it out.
Yeah, I think you've summed it up perfectly. I will also say, and not to be not to put out a tease, but I've tasked my marketing department with developing an algorithm to help with decision making around Giardia, and we're hoping to have that out shortly as a resource to share. I anticipate that we may not get it totally right on the first pass, but again, some of this we don't have clear answers to, and so we're all trying to do the best that we can, and certainly we've invited quite a few experts to comment on it to date so that we can really try to bring forward what we have, because again, we know it's tough.
Sure, absolutely. No, and I love an algorithm. That sounds great to just be able to walk through it, even if it's not perfect, to say, okay, here's some general next steps that we can communicate and have an idea of where we're going.
I love an algorithm too.
Yes. So let's move over to hookworms. Like I said, I'm in the Southeast. This is a parasite that that honestly terrifies me when I think of resistance and things. So I'm excited for our conversation here and to learn more. I know, my kids insist on running around in the yard with no shoes on, and it drives me crazy because I say I know way too much about parasitology to be okay with that. But what do we know as far as drug resistance and intestinal parasites, and specifically hookworms?
So I have kids too, and I think you know where I am. I'm out in Prince Edward Island, Canada, with gorgeous beaches, and my girls are doing the exact same thing, running around barefoot. And part of the reason that's pertinent for this conversation is because with hookworms, we used to think it was a problem just for you folk in Florida. I really also used to think that hookworm resistance was just a greyhound coming off the track problem. And these days, unfortunately, we know quite a bit more. We're sure getting into some heavy topics, Cassie.
We are.
Drug, and I think that's again, it sort of speaks to how veterinary medicine has changed. And so hookworms, Ancylostoma caninum. I usually just say hookworms because it doesn't exactly roll off the tongue. This is a parasite that is one of the most common GI parasites that we deal with in veterinary medicine in dogs. And so we're always finding it, right? We're finding it in puppies that haven't, again, had their preventive care as per recommendations. We're finding it in adult dogs. We're also aware that dogs are defecating into public spaces. There's numerous dog park studies. There's the beach reference that you made before. And so hookworms are in the environment. And what's terrifying, and I will echo what you said because I feel the same way about it. And I certainly don't want to be accused of fear mongering, but it is frightening because now we know that hookworms have developed resistance to the drugs that we commonly use to treat them. The key screen test from Antech does contain not only detection for hookworms, but also contains the marker for hookworm resistance, specifically benzimidazoles, which are drugs like fenbendazole or fabantal, so the really common ones that we use to treat hookworms. And so we also know that we're finding more hookworms and in places that we didn't used to. And the thinking on some of that is in part that's because that hookworms have developed resistance to some of the drugs that we use to them. We know based on looking at our big data set studies that we've done on fecal test results that are coming in from veterinarians, probably like yourself, Cassie, that hookworms and hookworm resistance specifically is no longer just a Florida or a greyhound problem. We've now found resistant hookworms in over 20 dog breeds, and we've found that throughout the United States, so not just Florida. We've also found resistant hookworms in Canada. So, and we also know from doing follow-up work on those dogs in Canada that some of those dogs weren't imported, which means that hookworm resistance is actually within Canada too. So it is a legitimate concern for all of us. I think the other thing that's tough is what do we do with these dogs? And I think many are, okay, we're going to reach for another drug, but the drugs that we have available, there's been reports of resistance against many of those, and also some of those drugs aren't approved for treatment or maybe a little bit nerve-wracking to use in certain cases. And we need to make sure, I'm speaking about amodepside, because there's been reports of resistance to that drug. And also, of course, that's a drug that we all want to be very careful to go through appropriate decision-making steps. And a good reference there is the clinician's brief algorithm for hookworm treatment resistance that Pablo Jimenez Castro put together as well.
And when you talk about being careful with emodepside, is that specifically because we really want to be careful to preserve that antiparasitic?
It's partly due to that, because that's very much a concern. It's also a concern, beyond the four legs, right? Because these are drugs, and hookworms are zoonotic. And so if we have drug resistance in our patient population, like dogs, it's also something that's a concern potentially in humans as well. And so amodepside is a concern for that reason. We want to be mindful about using it for that reason, because of reports of resistance, but also because it's not approved in the US. And also, too, is we want to be careful to make sure that our patient, our dog, does not have heartworm when we go to use it, because we can run into some fairly awful side effects if we use that drug in dogs that do have heartworm concurrently.
Okay, so a lot of considerations before we
Yeah.
reach for something like that.
Yeah.
Which kind of brings me to my next question, and you've touched on this a bit, of what are the recommendations currently around managing patients where we suspect or where we confirm hookworm resistance?
And that's a great question. And I think for me, I'm going to go back to what you said earlier about medicine. It depends, right?
Sure.
So it depends. Hookworms are complicated, I think, for veterinarians. For me, definitely. I've had to learn a lot about GI parasites over the past couple years, because we can get sort of hookworm, what looks like a persistent, I'm going to use the air quotes again, infection for a lot of reasons. Hookworms can do something called larval leak, which is
Mhm.
hookworms can almost like sort of nest or be in an arrested development stage in the muscle tissues, usually of a dog. And so we may treat for hookworms, but then if there's the arrested development stage, we can get a phenomenon that's called larval leak, which is that those hookworms in the arrested development stage can then, after treatment or sometimes during pregnancy, if we have that situation, can then be released again. And so that cycle can start again. And so there's a couple things that we need to look into before we end up deciding to call a hookworm infection persistent or not. Is there larval leak? The other is, as we talked about before, we led this conversation talking about our kids running on beaches, right? Hookworms are plentiful in the environment. So could it be larval leak that's causing the persistent or repeat test results, or not being able to get rid of hookworm in a specific dog? Could it be that they keep reinfecting themselves from the environment where it's plentiful? Or could it be a true hookworm resistance case? And so we kind of need to knock those things off the list before we move to that. Okay, I do think that there's hookworm resistance. The key screen test is helpful with the marker, because it sort of helps us figure out if there's hookworm present, if there could be resistance to drugs like fenbendazole or frabantal. And so again, these can be very complicated. And so definitely reach out, phone a friend. And this is another one where we're working on an algorithm, and of course have access to the existing clinician's brief algorithm right now to help us sort of walk through these cases and make decisions on what they might need.
You're right, like, with internal medicine and parasite resistance and all of the management topics we're talking about, like you said, it's like you dive in and with the answer to one question, and you end up with 10 more questions. Case in point, this conversation, I feel like every time you answer my question, I'm like, "Okay, but what about this?"
I,
Because it is
I know.
complicated and multifaceted.
It is complicated, but again, there's some excellent resources out there to support. And at the end of the day, sometimes it's good to do exactly what we're doing right now, which is just chat it out.
Yeah, yeah, absolutely. And along those lines, I have managed suspected hookworm resistance cases, and they're tough. I know exactly what you're talking
Mm-hmm.
about when you say, is it larval leak, is it reinfection, or is it resistance? And part of what makes that so challenging is talking to the owners about it, especially if you have an adult dog who is otherwise asymptomatic and normal stools. And it's really hard, even though there's some panic coming through on the veterinary side going, oh my gosh, this is a problem, we need to figure this out. It's hard to communicate that
Yeah.
urgency to the owners, especially we talked about spectrum of care earlier, when there's a price tag involved. And
Yeah.
so do you have any tips for communicating the importance of following these cases through and making sure we find the answer and treat these pets to the best of our abilities with communicating that with the owners?
Yeah, and I get that too, right? And so as a clinician, I think that's oftentimes what it comes to. It's not the okay, this is a complicated medical topic that we're struggling with. It's how do we convey that to a pet owner? Because I know we all want the same thing, right? And I go into these conversations with that hopefully top of mind, is that this pet owner also wants that too, right? Like they want the best care. I know it can feel like there's some exceptions and some tougher days, but at the end of the day, they want the best care for their dog too. And so when they have a pet that doesn't seem to have clinical signs, and yet we've found something, hookworms, how do we, communicate that? And one of the things that I do is just kind of go through that step by step. This is what we found, and I know acknowledge that they're concerned and I'm concerned, and have clear conversations around budgets and what will and won't work. And that gets into the, what tests are we choosing at that stage, and what diagnostics are we recommending. And also too, I have the conversation about, even though you can't maybe see this or see that your dog has a parasite, eventually we know that a high hookworm burden is going to lead to clinical disease. We also know that these hookworms are being shed into the environment. And of course, back to your earlier comment about kids running on the beach. And so that's another part of it. And also, so the environmental contamination aspect of that, especially in and around their own home, right? So those are things that I talk to. And then the other thing that I do is, because I know sometimes it's tough when everybody's got lots of things on their mind, is I provide them with those evidence and expert-based resources like the Cassi guidelines, so that they can go and see that what I might be saying as a recommendation, it's not just me. It is this larger expert and evidence-based group that are making these recommendations. And also so they have time to go and have a look at things and think it over, and then follow up with questions if they have them.
That's a really good idea. I like the idea of providing people with resources so that when they do have some downtime and they can absorb what you're saying, like you said, they can look at it and say, okay, this is not just my veterinarian thinks this is the best thing. They're following recommendations from other experts who have looked into this. And it maybe also helps illustrate why this is such a big concern, even though their pet looks normal to them. Why it's a concern for their pet because, like you said, clinical disease, whether that's GI upset or we end up with a cough, those always kill me where I'm like, oh, this just sounds awful. And yeah, so that it's a big concern for their pet, even though everything looks okay right now, but also just globally for them, for their family, and for parasite resistance in general.
It sounds like you don't need my help, Cassie.
I feel like it sounds like I need all the help. I'm so happy we're having this conversation because really I do feel like, Michelle, thank you for coming on and having this conversation with me. It's really empowering to hear that it's kind of clear as mud at this point. There's not a cut and dry right answer. And I think that makes me feel better as a clinician to go and seek out those resources and to have the conversations with owners of, we don't know exactly what the best treatment option is right now. So let's talk about this and let's figure out the right option for your pet and not feel like I'm doing something wrong or I'm neglecting a test or a medication or something like that, to say, you just really, at this point, we have to do the best we can with the resources that we have for our patients.
Absolutely.
Well, again, thank you so much for coming on and having this conversation with me. It was as many questions as it brought up. I think it was also very clarifying that there are a lot of questions and we still have a lot of research to get through to figure out what the right answers are. So to just keep plugging through.
Thanks, Cassie. And I think you're exactly right. And we crammed a lot into this, and wow, we could probably do another 3 or 4 of them.
I think so. Yeah. As you can tell, I have lots more questions.
So do I.
Yes. Well, hopefully we'll continue to work through them and we can get more answers as time goes on and continue to treat these pets and then just globally benefit everyone.
Thanks for having me.
And thank you to Antech for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.